clinic. My name is Samara Salame, and I'm a licensed clinical psychologist. Clinical psychology is a branch of psychology concerned with the assessment and treatment of mental illnesses, abnormal behavior, and psychiatric problems. They focus on diagnosing and treating mental, emotional, and behavioral disorders. As clinical psychologists, I have started my own program called Helping Minds Develop. Helping Minds Develop is a 100-bed psychiatrist hospital. The purpose of my center is to make sure that each individual receives individualized mental health treatment. Each plan focuses on the person's specific emotional and behavioral needs. We treat people that suffer from mental illnesses such as depression, anxiety disorder, schizophrenia, eating disorders, bipolar disorders, and mood disorders. Helping Minds Develop offers group and individual therapies in which we include the psychological model, the disease model of addiction, motivational intervention therapies, humanistic experiential therapies, and reality therapies. We also include nutrition meals that are prepared by a licensed dietitian that provides a balanced meal for each of our patients. Leisure activities, patients are able to participate in viewing recovery-related films, reading recovery literature, playing board games, and taking nature walks. Social support. A leader provides guidance to a new person, served with acclimation to the program. We also offer medication. Each person is given medicine prescribed by an appropriate medical person to alleviate any discomfort or reduce symptoms. Now that you know about my job, let me tell you about how I got here. I started my higher education at Valencia Community College in 2015. Earned my AA degree in order to qualify for the Direct Connect to UCF. After graduating from Valencia College, I transferred to the University of Central Florida and pursued my bachelor's degree in psychology, then my master's in clinical psychology, and finally, my doctor of clinical psychology. In order to become a licensed clinical psychologist, I needed experience working in a clinical settings. So I decided to work at the University Behavioral Center and loved my job. And after working for 2 years, I took the state exam and officially became a licensed clinical psychologist. During my second semester in college, I was required to take the new student experience class, in which I was able to find who I was and what I wanted to do, and what was my purpose in life. I remember that I was required to take an interview with a professional for my career, and throughout that interview, I was able to realize that I had the necessary strengths to work in this field. These strengths included empathy, being able to perceive how others feel, responsibility, taking good care of my patients, learner, wanting to know more about my patients in order to improve their life. The purpose for me seems obvious, being able to help others. During the new student experience class, I was able to plan the classes I needed to take in order to transfer to UCF. It also allowed me to calculate the time it will take me to graduate and know the total cost of my career. Sometimes I thought that my dream of becoming a clinical psychologist would never become true. I would spend hours in the library sitting by myself doing homework or studying. When I had math assessments or tests, I used the math center that Valencia College offered to get help and be able to score well. And even when I had essays to do, I would go to a writing center and use it as a success tool. I knew that all I had to do was give my best. If you don't mind, I'll be asking some questions.
Don't worry.
What brings you here?
Well, I have economic problems and also family problems.
Have you ever seen a counselor before?
No, at all. This is my first time actually.
Okay. What is a problem from your viewpoint?
Well, my parents don't stop fighting.
Mm-hmm.
I don't get a job, so I have issues economy. I need money to buy food.
Okay, how does this problem make you feel? Like sad, mad, hopeless?
Actually, really sad, depressed. I don't know what I should do or what I'm gonna do.
How would you describe your mood?
Well, I don't really know how to describe it. I'm just really sad.
Okay. What will make you feel more happier?
Feel better with this.
Therapies?
Yeah, therapy.
Okay. Do you consider yourself to have a low, average, or high interpersonal IQ?
I consider myself to have a low interpersonal.
I guess at the end, hard work does pay off.